Hi, my name is Dr. Eric Malicky, and I'm an orthopedic surgeon with Aurora Advanced Healthcare, located in southeast Wisconsin. I'm here to talk to you today about ankle arthritis, and actually one of the treatments that are used for ankle arthritis is an ankle replacement procedure. Many of you may be familiar with the term replacement surgery, referring to a shoulder, a knee, or a hip. And I'm sure many of you are not aware that an ankle replacement procedure is available for those who have painful ankle arthritis. Just to back up, my area of interest is foot and ankle reconstruction, and I've received a fellowship training in ankle replacement surgery. A normal ankle has the appearance of this model, with a simple hinge joint, but there's actually somewhat of rotation that we see as the joint moves up and down. And as you can see, this very simple model shows the three bones that make up the ankle joint. And traditionally, if a patient develops ankle arthritis, this is the result of an injury. Many of you may have injured your ankles through sports or through work injuries. But the injury could be either a break of the bone, or it could be a series of sprains, very bad ankle sprains. But at the end of the day, the trouble is, at a younger age, many people get ankle arthritis, and therefore what to do for it is a challenge. Traditionally, the treatment for this problem could be severalfold of options, one of which would be to simply clean out the ankle joint and remove small bone chips or spurs that they're referred to, and help the individual get back to their sport or to their work. In more advanced stages, however, of ankle arthritis, there really is not a lot of options that allow us to preserve the existing joint. And so historically, the treatment for an ankle that has become arthritic has been to fuse the ankle joint. And specifically what that means is that the bone between the tibia, this is the tibia, and the talus, and this joint are essentially connected and made to heal together. And over the course of many, many years, that operation has been very, very successful in alleviating pain. The problem with that operation, however, is that in the last 10 years or so, we've discovered that patients who have had a fusion long term develop arthritis in other joints of their foot or their ankle. And specifically, the subtalar joint, which is the joint below the ankle, or the midfoot joints, which are here. So many patients who have had an ankle fusion are very functional initially because they have very nice mobility in these joints. But the consequence is that over 10 or 20 years, these joints wear down. And that leads to a painful foot. So 10 or 15 years ago, more actually, but 10 or 15 years ago, more successful ankle replacements were developed. I say more because back in the 70s, ankle replacements were made alongside hip and knee replacements, but unfortunately they failed, and that probably has a lot to do with a better or a lack of understanding of the complexity of the ankle joint, but also the technology of equipment that can be used. So in modern era, in the last, say, 10 or 15 years, there are several designs here in the United States as well as around the world that are used to tackle ankle arthritis that involve a replacement option as opposed to a fusion option. And this model shows one example of one of those replacements. And when you think about an ankle replacement, I've presented this topic to patients before, and I was surprised to learn that many patients actually think that the ankle is somehow cut out and a new ankle joint is put in. But actually it's a very simple concept, and what's done is there's a cut on the bone, on the tibia, and on the talus. And this plastic model represents what would be the replacement, which is a metal, plastic, metal joint. And in doing so, the movement of the joint is preserved. And of course that has some real advantages if you think about it, not only in terms of pain relief, which is the primary reason to perform this procedure, but also in moving the joint, that preserves these other joints that would otherwise become arthritic. So as a take-home, ankle replacements have become very, very successful and used in intermediate and even some long-term studies. There's no question that an ankle fusion is a very good operation, but I think that an ankle replacement has become an accepted procedure and has very much been used here in the United States as well as around the world. So I've got a very good track record of ankle replacements here in southeast Wisconsin. I've been performing the ankle replacements since 2000, and as I mentioned, where I trained, we performed hundreds in a calendar year. So I think that information is important to understand. There are plenty of websites that we can link to allow you to get more information about the ankle replacement and the indications as far as whether you would be a candidate for this procedure. Thank you.